Hey, it's Dr. Danyo at North Atlanta Hair Restoration. I have a former and current patient who we did a hair transplant on about 12 months ago. This is Nick Parker. You had 1,500 grafts with us about 12 months ago.
Right.
And talk about your experience and how you found us and what you thought of the whole process.
I'll definitely lead off with it's life-changing. Something about it being 24, 25 years old, reaching your hand back here and feeling skin.
Yeah.
And then the jokes, the comments, it just does something that's hard to explain at a young age. And I hated it. I tried everything.
I mean, do you feel like it's kind of created a younger version of yourself?
Yeah, I feel like, I go swimming. I don't worry
Yeah.
about going swimming. The windows down in the car doesn't bother me. My hair doesn't have to be styled perfectly because I have hair back there. I'm not trying to cover anything up anymore.
And you were saying your hairdresser loves it?
Oh, she is blown away. When I first got it cut, she felt it and was like, "It's real hair." I said, "Yeah, it's not plugs.
Yeah.
It's my hair growing out of my head again."
Oh, yeah.
Where I thought I would never have it.
When you came in initially and then looking at your before and after pictures, looking from the side of your head, so like the side view, it was almost like there was like a shelf because you just didn't have any volume up there. And,
Right.
And obviously, that is gone right now.
Totally.
You can look towards me. That shelf is gone. Obviously, looking from the back, it's like nothing's happened. Now, we did a shaveless procedure, and it's kind of something that we're known for doing. In fact, we do actually shaveless about 70% of the time. Talk about the shaveless, like you even went back to work the next day?
Yeah. I drove home. I drove myself home from the office.
Yeah.
There was no blood. The best comparison I have is sunburn. You didn't wear a hat and you were outside all day. Within 2 days, it starts feeling better. I'd say 10 days, you're going to have a little itch.
Yeah.
And after that, it's like nothing happened.
Yeah, and you just kind of scrub the scabs off.
With a little bit of conditioner.
Yeah.
Yep.
And we use this app called Clara. And for a lot of people that do consults with me, I do a lot of our video conferencing through the Clara app, but it's great post-op. I mean, you were dealing with our staff. If you had any questions, you text us and we text you right back.
Right. I mean, instantly. Even if I show up down here not expected,
Yeah.
after hours, I'm greeted at the elevator by you. I mean, that's service.
Awesome. Obviously, this is a team approach. Back in the day when I was first starting, I did a lot of these procedures. It was me and one technician, and it was a lot of work because we have to get you numb, get you comfortable, and then we have to core all the grafts, and we have to pull them, and we have to load them, and we have to place them. So we obviously had a big team. In fact, my physician's assistant, Lena, we call her, but her real name's Paulina. She's been with me now for 2.5 years and is just killing it with her technique.
Yeah.
And obviously, I taught her how to do my technique, and we worked together. And what did you think of the efficiency and just her presence, having a PA and a physician working on you?
It's like having two professionals, 4 eyes, all on your scalp at one time.
Yeah.
I can't say I've ever had care like that anywhere else before. Any other surgery I've had has been one surgeon with a team of nurses. But it was like 2 equals working on my scalp alone.
Literally my whole career, because I come from a pain management background. So, I would do really painful procedures like epidural injections, even intradiscal procedures with minimal to no sedation. And one time I had a neurosurgeon call me and he said, "What are you doing on my patients?" He just started sending patients to me. And I said, "What are you talking about?" And he said, "Well, I send patients there and they're kind of painful procedures, but everybody's saying they had a great experience, no sedation and minimal pain. So what are you doing?" So, now that we're on the pain subject, it's kind of the biggest fear that patients have. I mean, how was your pain during the procedure? We didn't do it with sedation.
No, I was awake the whole time.
Yeah.
And anytime like you would do one, if I'd flinch, we would numb it some more. And it was like a dental procedure.
Yeah.
You could tell somebody was back there, but painful is not what I would describe it as.
Almost like you had a helmet on your head.
Yeah, it was kind of like, and you could move your face and you wouldn't feel anything back there at all. I mean, it was totally numb to the touch. Wore off about an hour and a half afterwards.
Yep.
I started regaining feeling again. But during the procedure, no, I was not in any kind of pain.
You know, one of my big things with not doing sedation, especially heavy sedation on my patients, is that I want people to remember like an awesome day. I mean, I've had patients go other places, they get sedated. For one, they don't know how many grafts they got. They really didn't see the doctor around all that much, and they don't have any memory of the day. And you have...
Full memory.
And it was good or bad?
Yeah, I feel like we got to know each other while I sat there the whole time.
So you had a great experience.
Yeah, it was fantastic.
Yeah, awesome.
Yeah.
And how about the rest of the staff? I think you worked with Renee, one of my main techs.
Yep. Pretty much everyone was wonderful.
Yeah.
Along the whole process, from the first consult to even the follow-up a year later.
And you've been working with Jessica, my office manager,
she's
to
wonderful.
set this up.
Yeah.
Awesome. Now, what advice do you have for people that are kind of on the fence about getting hair transplantation? Now they're seeing you with before and after pictures and hearing your story, and I really appreciate you doing this. What kind of advice would you give to people that are thinking about it?
The one thing I would say is that the sooner you do it, the longer you have to enjoy it. I wish I would have had this done immediately. When I first had this, I tried everything you could, topical, medication, even topic fibers to cover up the bald spot.
Yeah.
And now I never worry about it. I almost forgot that it was ever bald.
Now, were you nervous kind of coming to the procedure?
A little bit.
Yeah.
No one I'd ever known has had a hair transplant, anything like that. And it's, you read around online, you see these pictures, but you don't actually meet somebody that's had it done.
Yeah.
And it's nice now. I want to tell everybody that I know that's thinking about it, like it's okay. It's going to go well. It's going to look great.
I really appreciate you coming on board.
Oh,
I think
no
we hit a lot of topics. And if you're thinking about hair transplantation, you can reach us at nahairrestoration.com or call 678-845-7521. And that's our direct number. When you talk to the front office and they set up an appointment, you'll actually be meeting with me either in person or online, and we can do a video chat, or you can send them pictures and we can just do a phone call similar to what we did a little over 12 months ago. So, but again, thank you for watching, and we look forward to sharing more content in the future. Again, thank you, Nick.
Thank you.